In this video, we're going to talk about experimental research methods. This is specifically for advanced placement psychology or Psych 101 if you're taking it in college. So, what is the purpose of experimental research? The purpose is to show cause and effect between variables. Now, this is different than correlational studies, where in an experiment we have an independent variable, and the independent variable is going to cause a difference in the dependent variable, and the way we measure that is by manipulating the independent variable and then measuring the dependent variable. Now, a correlational study is different because it just looks at naturally occurring relationships between variables. Now, what is the difference between independent and dependent variables? So an independent variable is the variable that is changed by the researcher, and then the dependent variable is the one that changes as a result of changing the independent variable. So let's look at a few examples. So the independent variable is kind of the cause, the dependent variable is the effect. And so cause could be the type of pill that a patient takes or type of medication. Then the effect is the pain they feel or their health. And so if you want to identify the dependent and independent variables from looking at a hypothesis statement, a hypothesis is always going to be in an if-then statement. After the if, the independent variable is going to come, and then after the then, the dependent variable is going to come. Now let's talk about experimental groups and control groups. So an experimental group is the group that is exposed to the variable where we manipulate the factor of interest. So this would be like the group of people who take the real drug in an experiment. And then control group would be the group that is exposed to nothing, or a placebo, which would be like a sugar pill, which is not supposed to do anything of real impact to the patient's health. Now, there's something called the placebo effect, which you have probably heard of. It's a measurable, observable, or felt improvement in health as a result of believing that the treatment that the person receives is effective, while in reality the treatment itself has no effect on the health. So an example would be sick patient feels improvement after taking a sugar pill she was told was antiviral medication. Now, in an experiment, we need to have two things. We need to have random assignment and, if possible, double-blind procedure. So let's talk about what those are. Random assignment means that the participants are randomly divided into control group and experimental group. The reason this is done is to control for or even out the confounding variables. Confounding variables are variables that are different from the ones that are being studied, but they can impact the results. So if you're doing a study on the impact of exercise on weight gain, the variables is exercise and then weight gain, but a variable which may affect weight gain but may not be exercise could be a person's normal metabolism. So that could be a confounding variable, and so in order to even out the confounding variable, we do random assignment, where we divide the group of people in the experiment randomly into control and experimental groups. So we also have something called a double-blind procedure, which is a situation where the test subjects and the researchers do not know who is in the control group and who is in the experimental group. So the test subjects, right? Let's say we're doing a clinical study where we're trying to figure out the effect of a drug, right? The patients don't know if they're receiving a placebo or if they're receiving the real drug, and the researchers do not know which patients are receiving the real drug or which ones are receiving the placebo. And this is done to try to take the bias out of the experiment, both on the part of the test subjects and also the researchers. So a third party determines who gets the Well, a third party does the random assignments is really the way this works.